This is the first part of the lecture series for PATOS coordinators, prepared by Dr. Young-Sun Roh. In this session, we'll be studying injury epidemiology and surveillance. Beginning with the definition of injury, an injury is the physical damage that results when the human body is suddenly or briefly subjected to intolerable levels of energy. This definition also corresponds with the definition of trauma. However, there is a distinction between trauma and injury. So, injury includes any functional impairment which results from a lack of vital elements such as air, water, and warmth. So, injury by definition, it would include drowning, strangulation, freezing, or burns. Out of all these types of injuries, we specify trauma as any physical damage resulting from outside force. It is also known that the time duration between exposure to energy and the appearance of injury is very short. Public health burden of injury is very substantial, as it endangers over 15,000 people's lives every day. It means that every 5 seconds, someone in the world is dying as a result of injury. Injury also affects not just the patient, but also their family members too. As a result of the injury, family members and communities are also affected both psychologically and financially. So we see that the public health burden of injury is very severe. Depending on the severity of injury, we can divide injury into fatal and non-fatal ones. About 5.8 million people die every year as a result of the injury. It actually accounts for 10% of all deaths globally. As you can tell by the graph, there are about 1.3 times more injury deaths compared to combined deaths from infectious disease, including HIV/AIDS, tuberculosis, malaria, which are the 3 main targets of MDG. In terms of types of mechanism, road traffic accidents, homicide, and suicide mark up a large part of the total death. About 23% of all injury deaths are due to road traffic accidents, and 26% of deaths are due to suicide, violence, and homicide. Other main causes are falls, drowning, burns, poisoning, and more. What is more important is that injury mortality is a leading cause of death, and it is projected to rise higher in the rank. According to a WHO report, road traffic injuries were the 9th leading cause of death in 2004, and suicide was 16th in the rank, and violence and homicide in the 22nd. WHO predicted that by 2030, all the 3 types of injuries would rise higher in their rank. Road traffic injuries will be the 5th leading cause of death. It indicates that the public health burden of injuries is very severe, and is going to require more attention and prevention measures in the future. The increase in the burden of injuries are more clearly observed in low and middle-income countries. In developed countries, there is a larger number of people wearing seatbelts or regulations and enforcements on road speed limit and jaywalking. However, in developing countries, there are less regulations enforced in spite of increasing number of vehicles, which attributes to a dramatic increase in road traffic deaths. In countries like Venezuela and Guatemala, a rapid growth in economy brought a big gap between high and low socioeconomic groups, and this has led to an increasing number of violence and death. Because this public health burden of injuries are very much observed in low and middle-income countries with no prevention measures, there are also large disparities observed between these countries. If we look into Asia, there are more low and middle-income countries than any parts of the world, and we observe a large burden of injuries here. On to non-fatal injury. Fatal injury is a small proportion of total injury incidents. As you can see in the injury pyramid, there are a lot more injured patients who seek healthcare, including hospitalization, emergency department, or primary clinics. And we also have a large number of patients that do not go into hospital for several reasons, such as mild severity, affordability, alternative medicine, and self-treatment. When we want to estimate the burden of injuries in a country, we want to know about injury severity, accessibility to healthcare system, and quality of data available in the country. Such factors make up different shape of injury pyramids. It may have a sharp top or have a large base at the bottom. So far, injury has been regarded as disease resulting from accidents or careless mistakes. Despite being predictable and preventable, there are not a lot of prevention programs and research about injuries. But recently, people are seeing injury as a preventable disease, and therefore we are in need to implement effective prevention measures to reduce the burden of injury. However, before we develop prevention measures, we first need to assess the magnitude of injury or the shape of injury pyramid. This can be done through injury surveillance. Injury surveillance can be used to identify risk factors, develop interventions, implement them, and feed back the change into surveillance again. As we saw in the previous slide, injury surveillance is a basic step for controlling the burden of injury. Injury surveillance will allow us to assess the burden of injury, how many are dying because of injury, how the quality of life has changed, who is at the risk of injury, and how trauma care is provided in the community, pre-hospital, and hospital stages. All this assessment and monitoring process will help us develop and implement effective prevention methods. After that, we can also apply injury surveillance to assess the impact and effectiveness of these prevention methods. WHO operates health statistics and information systems, which aims to provide information on global health. This kind of information is important for identifying public health needs, making decisions, planning resource allocation, and developing and implementing prevention programs. This is why WHO highlights the importance of health statistics and surveillance systems. On the WHO website, there are global statistics about many types of diseases and illnesses. This is an example for road safety. Every year, 1.24 million people die of road traffic injuries globally. Vulnerable populations include cyclists, motorcyclists, and pedestrians. Only 7% of the global population live in countries that have comprehensive laws on 5 key risk factors. Based on statistics, WHO identifies populations with high risk of road traffic morbidity and mortality. WHO also shows road traffic death rates by country. In Asia, we have more low-income and middle-income countries than any continents do. We also have high injury mortality rates. For instance, Myanmar has 347 injury deaths per 100,000 per year. The average mortality rate in 20 top countries in Asia is 88 deaths per 100,000, which is more than twice the burden of OECD countries on average, which is 39 per 100,000. The fact that Asia countries observe a higher burden of injuries was an important driver for implementing the Pain Asia Trauma Outcome Study. We'll now move on to the needs and objective of the PATOS research. As we have seen in the previous session, Asia has a higher incidence and mortality of injury than any parts of the world, and many countries still have relatively underdeveloped trauma care systems. Treatment of injury should begin promptly after its incidence, but there are close to no guidelines available about pre-hospital care and treatment of injury, let alone data or injury surveillance about pre-hospital care. Few countries currently have hospital-based injury database, and evidence from hospital-based studies are not sufficient enough to understand pre-hospital care. Most countries in Asia suffer from high burden of injuries, lack of effective trauma care systems, and surveillance system. Reiterating on the same issue, injury surveillance systems are vital to prevent and manage injuries. Based on the data collected, we can identify research topics, design and conduct in-depth studies, develop prevention measures, and evaluate effectiveness of the prevention strategies. Systematic approach is also crucial for reducing the burden of injury, as it covers trauma care systems at individual, community, pre-hospital, and hospital levels. Development of a trauma care system requires organized and coordinated efforts and cannot be done without cooperation with local public health systems. The trauma care system operates around the chain of trauma care, which begins with injury prevention, pre-hospital care and transport, hospital care, and to rehabilitation. All need to be organically linked for successful trauma care system development. So this again is why we need to investigate and compare the trauma care systems of Asia. Trauma care system is the essential component of patient management, and it is important to understand the variations between trauma care systems, trauma outcomes, and system determinants. Based on the results, we aim to benchmark well-developed trauma care systems and enhance healthcare outcomes of trauma patients. Trauma registry is challenging, but it is probably what saves the most lives and produces the best outcomes. The registry will serve the purposes of monitoring and evaluation, which is the core function of public health and the stepping stone for preventing trauma. Injury surveillance in Asia will measure the incidence, process of care, and outcomes of injuries, increase awareness and recognition about the burden of injuries to all stakeholders, research for interventions that are specific to Asia, benchmark well-established trauma care systems, and continue to monitor and evaluate performance in trauma care. PATOS is an international, multi-center, population-based cohort study of diverse countries in Asia. And we hope to build a standardized data collecting system across participating countries, which will be used to identify and study modifiable risk factors for reducing the burden of injury in Asia. To promote injury prevention in Asia, PATOS will first compare trauma care systems of pre-hospital and hospital stages, describe and compare incidents and outcomes of trauma, understand risk factors and epidemiology of trauma, evaluate indices of trauma care system, and calculate standardized trauma mortality rates in Asia. To summarize, PATOS will serve as a starting point for reducing injury burden in Asia, benchmark best trauma care practices and systems, and develop and support injury prevention strategies. So this ends the first session of the education. Thank you for listening.